Now we're going to take a look at the Reach Box, which is a sensory toolkit that you can use to help accommodate kids with sensory, developmental, or behavioral needs. You'll notice on the front of the box is the Reach logo, and it stands for Respecting Each Awesome Child Here. On the back of the box, you'll find a family questionnaire very similar to what's built in Epic, as well as a menu of items that are in the box. The family questionnaire asks, how does your child communicate with you? How can we prevent your child from becoming anxious or upset? How does your child respond when they're anxious or upset? And what can we do to comfort your child? This section offers suggestions based on what the family told you comforts their child. So if they're sensitive to stimulation, you might offer noise-canceling headphones. If the patient benefits from chewing, there's chewy tubes, which we'll look at together. If they like tactile stimulation, there's a massager or sensory brushes. If they like toys that spin, there's a spinning toy. If they just need relaxation, there's a sound maker or noise maker in there that's calming. And then there's other distraction items. So now we're going to take a look at what's inside of the box. So simply take the lid off and you'll notice on top here, these are items that the patient will use one time and they'll take it with them. So these do not need to be cleaned and returned to the box. So in this section, we have chewy tubes, which are helpful for kids that you notice are chewing on things, the medical equipment, their clothes, or biting on objects. You could offer a chewy tube here. These are actually really popular, and you'll find that you'll need to restock those often. These are sensory brushes, so these are meant for just calming of the patient, so you can brush this on their arm or on their lower leg. You should avoid their abdomen or central areas of the body. But these are often helpful for calming. In this section, these are called worry stones, and so these are for kids that are over age 3 that don't tend to put things in their mouth because we don't want them to choke on this. But essentially, it's a stone that they can kind of rub their finger over and bend and twist and just sort of play with throughout the visit, and then they can take it with them. In this section, this is more of a prize or reward section. So these are things that you can just give to the patient if you need to do a procedure. You can take one of these with you and, use it as a distraction during and then give it to them or give it to them afterward. There's scratch and sniff stickers, little fidgets with marbles, stretchy tubes, and other just little fidgets and poppets in here. Looking in the bottom section of the box, this is the area where there's distractions that are meant for repeat use. So these will be wiped down with a purple wipe and allowed to dry and then put back into the box after the patients use them during the visit. So we have a motion bubble timer. A lot of times kids like to use this repetitively just to watch the bubbles. That keeps them calm, as well as other distraction items in here. There is noise canceling headphones, which are helpful if the area is loud or if the patient is sensitive to sounds. There's another bubble timer in here. There is the spinning toys that they all seem to enjoy. We have the noise maker, the sound maker, massager, caterpillar, fidgets, rainmaker, and a 3D pin art, which tends to be a favorite also. So when you're done with them, just clean them, put them back in the box. And you want to offer just 1 or 2 items at a time. You don't want to offer all of the things at one time, as that would be overwhelming and would be less helpful for distraction when you need it. The REACH program has always been supported by associates. This is a way that you can make a difference for kids with sensory, developmental, or behavioral challenges at Nemours. Through the Associate Giving Program, you can make a one-time donation to the REACH program, you can make recurrent donations through payroll deduction, or you can even sponsor a REACH box for your department. You can use this QR code to do that. And you can email us at reach@nemours.org to let us know if you've sponsored a Reach box, and we'll happily deliver it to your department and include the education that's needed, as well as signage and door hangers if that's what you prefer. If you have any questions about the Reach program, you can contact the Child Life Department, you can contact myself, or Kimberly Zalewski. You can also email reach@nemours.org.